Cannulas are one of the most commonly used equipments in clinical practice. Intravenous cannulas are mainly used to administer fluids and medications. In addition, they are used for blood transfusions and drawing up of blood for investigations. In this video, you are going to know the different types of cannulas according to their gauge, color, and flow rate. It is important to know that the lower the gauge, the higher the internal diameter of the cannula. Thus, the gauge is inversely proportional to the flow rate of the cannula. Let's start with the largest cannula. The orange cannula has a gauge of 14 and is used in situations where rapid restoration of blood volume is required, such as sepsis, hypovolemic shock, and severe dehydration. It has the highest flow rate of all the cannulas, and it is about 270 milliliters per minute. Next up, we have the gray cannula with a gauge of 16 and a flow rate of 180 milliliters per minute. It is also used in situations where large volumes of fluid should be given. In addition, it is used in major surgical procedures, and both orange and gray cannulas are typically used in adults. The white cannula has a gauge of 17 and a flow rate of 125 milliliters per minute. It is used in blood transfusions, trauma, and major surgeries. The 18-gauge green cannula has a flow rate of 80 milliliters per minute. It is used in adults, adolescents, and older children to administer various intravenous medications and fluids. Next up, we have the pink cannula with a gauge of 20 and a flow rate of 55 milliliters per minute. It can be used in adults, adolescents, and older children to administer intravenous fluids and medications. The blue cannula can be used in the elderly, adults, adolescents, children, and toddlers to administer intravenous medications. Its gauge is 22 and has a flow rate of about 33 milliliters per minute. Then we have the yellow cannula with a gauge of 24 and a flow rate of 20 milliliters per minute. It is used in adolescents, children, toddlers, infants, and neonates.